What's up, everybody? I am so excited. I have missed y'all so much. While we're working on changing up this schedule, it's our first webinar in December and our last webinar in December before we move into the new year. And of course, I don't do anything halfway. We're ending it with a bang. So if you have been a long time attendee of the webinar series, then you know this man is no stranger. I really need a shirt that says Dr. Ebel Fan Club President, because I absolutely am the biggest fan of Dr. Tony and his team. I have told the story a zillion times. My own family has been impacted. Y'all see this little picture behind me, that little blue blur? That would be my baby girl. And she lives a full, happy, healthy life. And nobody would know the trauma she experienced before she came into my life because of Dr. Tony and his team and the protocols that they have and the help that they provided our local chiropractor and being able to treat my baby. So I'm super, super stoked to have him here, just in case you might not know who this incredible man is. Well, first of all, he is the dad to the four most adorable children ever in the entire world. I'm so excited that we're Facebook friends because I get to watch the adventures of Tiny, though Tiny is not tiny anymore. He has a beautiful and amazing wife and partner in his practice, in his life, on his farm. Christina is the most amazing woman in the world. Like, she helps pull it all together. And so, Dr. Tony, you know what they say, every great man has an amazing woman behind them, and that is what Christina is. His heart for this profession is just unbelievable, but his heart for helping pediatric patients, for helping families who feel like they do not have options, that they've run out of options, for helping their children live a full and happy and healthy life. That's what just makes my heart skip a beat. He has a 6-doctor practice, 65% pediatric, 100% cash, and according to him, 100% crazy fun. It's PWC Chiropractic in Crystal Lake, Illinois. He's also spent the last 10 years teaching and training other chiropractors. If you have the opportunity to hear him speak live, if you think he has energy on this platform, you've seen nothing yet. In 2020, he and his wife, Christina, launched the Pediatric Experience, a first of its kind online mentorship and training program that teaches chiropractic students and doctors every single element of what it takes to build a wildly impactful, successful pediatric, prenatal, and family practice. And for those of you who live near Life College, Life University, just know that it's not uncommon to find Dr. Tony and friends hanging out on the college, impacting future chiropractors in this profession and letting them know that our littlest patients, sometimes that they need what we have to offer most. So thank you so much for being here.
You got it, my friend. I am here to help us serve more kids, number one, for sure. But a very close, like right up there, is to hang out with you. Your awesome accent. I showed a picture of like the Instagram stories our team put out there, and I was like, look at how beautiful and awesome Christy looks. Like her makeup is done, her hair is doing things I didn't even know hair could do. And then there's me. I don't have any hair. I'm like, who put these pictures together? We could have done separate stories for this. Yeah, I love you, and I'm ready for this.
Well, I am excited. I am so excited.
Ready for me to
you rock just and roll? Do your thing, and I'm going to disappear and sit in the background.
Yes, ma'am. Yes, ma'am. Okay. Well, as you explained, when with Christina running my life, she's very involved in both the practice, PWC, and PX. She is the chief. She's the real CEO, the chief execution, not executioner, execution officer. And so then in practice, other rock star ladies run the show for me. And when I get to hang here with you guys, I just do what Christy tells me to do, because that is the best life, where you don't overthink it. You just do what rock star women tell you to do and make it happen. We've got our slides we're going to go through today. I chose a topic that I actually technically am always talking about, but I don't always put it in the title, especially the R word of research. And so I know as chiropractors, I know I always have, always will. Love the science. I really, really, really got my spark and my certainty and my drive through the science of chiropractic. It was the science that led me into the philosophy and falling in love with that. And then as a chiropractor, you can't skip the art part. Like you got to do your job. So that was always there. But what you shared in the beginning there, Christy, you used these two words I put into my notes, and they're perfect for the clinical application of today's training. And it was protocols and then options. So that's really two things. Like those are the two absolute kind of lanes I've been obsessed with in my clinic and my time, 15 years as a chiropractor. What I learned is that when I started practice and wanted so badly to take care of kids, because our first of those 4 beautiful babies was born 2 weeks before I graduated, I had, and there's other words we can use, but I literally had no clinical protocols, no training at all when it comes to taking care of kids with chiropractic. So I had a complete lack of protocols. And then from there, I signed up to get my pediatric certification, which many who probably will join in here, maybe you have yours, either your certification or your diplomate. And so what happened when I went down that road looking for a protocol, hang with me on this, splitting these hairs is super important. When I was looking for a protocol to apply in my practice for pediatrics, I ended up getting like 8, 10, 15 different protocols. So I was looking for a blueprint and a singular, organized, systemized. I'm not afraid to use those words. I'm ADHD and crazy, but that's why I love organization, because it's how you get things done. And so I wanted that singular path and clinical protocol that would get kids better in a subluxation based, philosophically congruent, cash-based model. And I didn't get it. I ended up getting my certification and all these other trainings, but I was all over the freaking place. I got too many protocols, and I was like Ricky Bobby and Talladega Nights, like, I don't know what to do with my hands. And then the other thing we're talking about today, like these are the two parallel paths we're going to be on the whole time, is options. The other word Christy used in the introduction was options. What is happening today is parents are done, like cooked, overcooked, tired of it, sick of it, of their kids being sick, and the only option they feel like they had, actually the only one they were aware of until a little thing called the internet came around, was medicine, pediatrician, antibiotic, corticosteroid. Here we go. Get on that cycle of sickness, get in the perfect storm, and how the heck are you ever going to get out if you don't know you have other options to get out? And here we have been this whole time, a different kind of doctor. Different doesn't mean, oh, we're better and they're bad. That's never how I will present. Medicine saved my son's life. Surgeries, medications, interventions. I have the most respect for modern medicine in life-saving, fire-putting out application. Health promoting, resilience building, neurological restoration, chronic challenge restoration. They stink. And so options for parents today have changed. When I'll get to the slides after this statement, when I started my practice, 80 to 90% of our patients 15 years ago, new patients calling in, doing intake, almost 100% of them were for their kids, already had their kids on 2, 3, 4, 5 different medications. Okay. The vast majority of my patients were medicated when we started care with them years ago. Today, fast forward to today, the practice you're in, the practice I'm in. I used to call this thing we're about to talk about the practice of the future. I was wrong. It's the practice of now. The market, moms, Christy, Christina, they are coming for us. It's our job to get our occiput dislodged from our anterior sacrum, figure out exactly what's going on with the science and clinical application, and be there for them. Okay. That was a nice way of saying, you know what I was trying to say. And so what is happening is they're coming forward for us. And now only about 10 to 20% of our new patients are medicated. We used to joke that we should answer the phone, welcome to the last resort. I'm happy to announce to you today on this time getting back on the Chiro Health webinar series to tell you now we can answer the phone, welcome to the second to last resort. So I'm excited and still pissy about it. Here's why. Excited because parents are moving medicine where we all strongly feel it should be. Last choice, last resort. That doesn't mean it's not life-saving when needed. But how the heck is an antibiotic the first thing that is going to help build health? How is Adderall going to get a kid's brain and central nervous system calmed down and better? So using drugs as first choice got us to the first generation where kids are not expected to live as long as their parents, and the sickest, most medicated generation ever. Options. The options parents have got them here. They want out. They don't want to go there. They're aware. Thanks to the internet, information, Instagram, Facebook, everything we're doing with our PX Talks platform is helping. And so now we go here and we are moving up options in a good way. Guess what's kicking our butt? Gluten-free, casein-free, supplements, essential oils. Some of you, I know who I'm talking to. It's chiropractic, crew here. So we love our natural health. Natural health is the hottest market in healthcare. Traditional medical health, drugs first, going down. Its market share is shrinking. Natural health, Chipotle, Panera, gluten-free, casein-free, chemical-free, on fire. Essential oils, ancient nutrition, you name it. We're actually in the third category, and I want to show you the research and talk you through the science, and then most importantly, the clinical application between what is a third option for parents, and that is actually let me do this real quick first, to carve out our own spot as what we really are, a neurologically focused health care option. So I want you to focus on these words with me today. Are we going to get sciencey? Are we going to say big words like disaffrontation, dysautonomia, developmental discus, the prefrontal cortex, the hippocampus, the amygdala? Woohoo! Party on, nerds. Okay. Us nerds do no good in the world if we don't clinically apply it. So what I have always been obsessed with, which is why I had to leave the organization within chiropractic which was an awesome journey for 10 years, and create the pediatric experience, which is where we are, is because too much of what we're taught as chiropractors on webinars, in seminars, coaching management groups and everything else, it's very right material. The theory, the concepts behind them are so accurate and they're so correct, but the application, the implementation, the step-by-step, step 1, step 2, step 3 clinical application so often is lacking from someone who gets an opportunity like I have to teach and share what they've learned. And so my obsession is to teach things not in a 30,000-foot view or an academic view where you're like, wow, I have more research studies to put on my shelf. How do you actually apply this? So most of the slides are really focused on not just showing you research and we all get to nerd out for an hour, but showing you how to actually upgrade. That's the word I kind of was having in my head here today. How to upgrade your clinical protocols and the care you provide, because it's not a treatment, it's not a cure, it's care for pediatric chiropractic. Now, the fact that that's a perfect little segue there. The fact that we don't work in a treatment model, we don't work in a care or a cure model, we work in a care model. It actually makes it a little bit harder, or a lot of it harder, to research and make sense of. So we're going to break that down. Okay. Fair warning before we get too much into the research. I'm a practicing chiropractor. I am a brick and mortar in there, every day for 15 years, serving kids. And I'm not a researcher. I'm not an academic. I love school. I love learning. I love reading papers, but I only love them for the purpose of, does this make me better in practice? Which also means I'm not one of those practicing chiropractors who's like, oh, we don't need any research or see the miracles all day, every day. So do I. I just love to, be able to explain the miracles first to myself. So I'll switch it from A to number one. I love to be able to explain and make sense of the miracles myself. I have to know the science. I've got to understand what I'm doing, how it works, why I'm doing it. Number two, once I have it, it'd be selfish of me to keep it. So I'm going to communicate it and share it with the world. And number three, now my job is to teach it to other chiropractors. So when we look at research, here's what's happening. Number one, our job, we've got to really, really understand exactly what's happening to kids. So we can look at some stats and we can look at some studies and really get a picture of what we are up against. Or I love if you have a certain belief about you like I do, I will say it this way. What we're called to do. For me, I know what God's calling for me to do. It's to not only be a practicing chiropractor, putting my hands on kids and experiencing miracles, but teaching and sharing it with the world and others. So knowing what we're up against, helps us know what we're called to serve and do. Number two, what's our role? Okay, kids are sicker than ever. There's more stress than ever. There's more autism than ever. There's more medications than ever. Okay, well, how could we help? Well, we got to get down to our basic sciences. We got to get down to the neurology and the actual science of what we do. Number three, all right, we know there's a problem. We know the perfect storm is brewing. We know kids, if you missed the intro, I'll come back on it one more time. Kids not only need us right now, y'all, moms and dads want our care right now. If you apply 10%, we have an online membership seminar. If someone applies, and I know this could sound all hoity-toity and fancy, I don't have that fiber in me. Okay. It's just true. I really actually mean this math. If someone applies 10% of our practice blueprint right now in the market today, their practice grows quickly, fast, big with pediatrics and family. You literally can't mess this up. You also, I'd be remiss to say, you also can't fake it. This is not pediatric prenatal family practice. That's Christy's baby. There's no way that boss lady, she knows when someone's scripted. She knows when they're actually Back Pain Bob, the chiropractor, kind of portraying themselves as a family chiropractor. So you got to know it. You got to know how to apply it. And when you do these things, I'm telling you, the moms in your community will come screaming. Minivans on 2 wheels. They don't even slow down. They're just slowly rolling in the parking lot. They hit a button. Kids, get in there. Get adjusted because it's cool. Minivans are badass. The sliding door just opens. I don't know if you can do it while you're driving. I don't have one. Never tried it. But I just had a cool image in my head there. Our parking lot is full of minivans and SUVs all day, every day. Okay? So we're going to learn how to clinically do the job. And we're not done with our job after you understand it scientifically. So we'll kind of combine 1 and 2. Learn how to apply it, adjust, clinical case management, care planning. I'm going to get real minutia with the clinical application of this work. And then number 4, cool. You know it and you know how to do it, but who are you doing it for if you don't know how to communicate it and actually get new patients in the door? I don't even mean to rhyme there, but that did. Okay. And so this is also something I've studied my face off forever is communication, marketing, and branding. We've had a huge scientific and, understanding and clinical application, that's what I'm looking for, gap in the pediatric part of the profession forever. We've been rather interested in osteophytes and back pain. And I feel like at some point we ought to just say, okay, we got that down. We could maybe spend a little bit more money and time elsewhere. And so we're so stuck there. We've got a branding and a marketing problem. And then we have a science problem, but then we have the communication problem as well. And we're going to look to get through that because science and story put together are the 2 biggest communications. So a lot of chiropractors want to rely on story only. Hey, I see the miracles. I've got the testimonials. I understand the philosophy. That's all I need. I'm good. I love you philosophically. You might have a miniature green book in your pocket and you wear a green jacket to work. That's awesome. I friggin' love it. Read the green books, love them. I literally read Stevenson. It actually begins right now this month. Every Christmas, because in the Midwest, we slow down, fires on, more time to read. I read the entire Stevenson. I've read it now 13 years in a row. I should have done it all the way back in school. I'm as green jacket loving as possible. On the other side of our profession, we've got all like science and analytics, and I don't need stories, and I don't need that. We have to take ourselves away here for a moment and realize that we didn't get in this for us to be right. I hope you got in this for their lives to be better. And what a mom wants from us, what a patient wants from us is to be able to have the science and the story, the research and the relatability. And if you rely on one or the other only, singularly, if you're just analytical Andrew or storytelling Steve, I'm not even going to give you credit as half as effective as the people that do both. If you want to save lives, you need both science and story and the ability to do it. So we're leaning heavy on science today, but you can see I'm trying to instill as much communication and storytelling into you as possible because you can't help anybody with a research study that isn't properly communicated and articulated to say, here's why you come here for care. So interesting timing. This is how God works. A couple months ago when Christy and her amazing team reached out and said, hey, you want to come back and webinar party or webinar jam with us? The answers are clear. Yes, always. Love this crew, and Chiro Health is so crucial to me. I'll be brief on this story because we got stuff to teach. I started not having any pediatric protocol, any training, any certainty, anything. So I started with a very typical chiropractic practice. I was going to serve adults and sports injuries and, neuromusculoskeletal stuff. And I had insurance and we had rehab. And when pediatrics caught fire for me, this is just me. I needed to get out of back pain. I needed to get out of insurance. I didn't need to get away from that stuff because I love that chiropractic helps people with pain without drugs. Obviously, that's a 6 million times better option than opioids and surgeries. It's just not my calling. Pediatrics and prenatal was. Well, I had gotten myself so entrenched in an insurance-dependent practice and my family's well-being was dependent upon it. I couldn't just pull the plug and change my practice overnight. So Christy and the team and the entire ChiroHealth team literally held my hand all the way through the process. We installed every system with HECKUVA, and it was literally I don't even know how else to say this other than this. It was everything to our journey. I know I'm talking about it while I have a research slide up, but it was everything on our journey out. So when we got to this topic, I thought, let's actually go through some research studies. Let's open up the hood. This is stuff we teach inside our program all the time. Like we don't rarely, actually, I guess it's probably the accurate word. We rarely, if ever, bring out these big smoking guns onto our Facebook page or webinars or that sort of stuff. It's usually held back for our in-depth membership training and seminars. But I just realized that the time is now. Parents are ready for us to be there for them. So we as chiropractors, when it comes to seeing kids, we will put a couple of accurate, but not as big as we make them to be, subluxations in our way. One of the biggest things that I talk to chiropractors and students, and they will come out with real early on, is they'll say, well, what happens when a dad, or what happens when someone comes up to me with a question, hey, do you have any research for that? Because I'm kind of channeling my inner new, not yet pediatric chiropractor in here. And they'll say, because do we have any of that? What is that? And they're so afraid of that question. And it holds them back from even taking a pinky toe step forward into pediatrics. And if you don't move forward into pediatrics, you're going to get stuck. I don't mean to say backwards, you start moving forward, you're going to get stuck in a pain-based insurance-dependent practice because there's only so many options out there, right? And so you got to pay the bills, you got to pay your loans back. So most family practicing chiropractors get pulled back into back pain, neck pain, rehab, and whatnot, and they don't get all the way in here. And a lot of times it's just actually this little hiccup of, well, what if somebody asked me that question? We have the largest, and Christy will laugh on this one, I would say we have the loudest pediatric practice in the world and platform. And it is probably once or twice a year on Instagram, on Facebook, or a dad in the practice. I mean this. I thought about this at this webinar. Once or twice a year, someone asked me the question, hey, do you have any research? Now, right there, I could take that in the direction, knowing that that's the reality I live with and practice every single day. I could take that into the direction of these research begone chiropractors and go, see, we don't need to teach this. I don't know if they talk like that, but you could just go into that road. That's not right. I really strongly believe the reason that we don't get the question near as much as any other chiropractor is because we pre-answer it because of our certainty and our clarity. And we actually communicate in a very science-heavy language because guess what we've done? Studied it. We know it exists. We know it like the back of our hand, and so we communicate it. So what I want to do with the back half hour of this is teach that to you in the same way. Because when you deploy it, are you going to get the question very often? No. But is it even about that? It's about the clinical application. So right in the same week that I get to give this webinar, we have our Speaking of Life University. That's where our certificate program is. So we now have the first of its kind advanced neurologically focused, subluxation based. We're the only pediatric chiropractic cert program that is chiropractic only. Love the other ones, but they put a lot of other stuff into it that's not chiropractic. Ours is an 80-hour, 60 online, 20-hour in seminar, hands-on with Life University. We have a ton of interns from Life. What's crazy timing, I'm doing this today. Yesterday, I'm filling out their review for this week. And then part of their clinical protocol is they have to discuss, or their intern protocol, they have to discuss the Sackett paper with me, which is what we've been looking at this whole time while I'm on this rant, about evidence-based, I can't say the word. It's titled, you can see the little guy over here. It's called, there we go, evidence-based medicine. Evidence-based care. I can't say the word medicine. So I'm going to read it differently, all right? And let's go through the highlighted ones that have been standard. The practice of evidence-based care means integrating individual clinical experience with the best available external clinical evidence from systematic research. That's a mouthful. What does it mean? First sentence that we highlighted here. Your actual practice experience. Now remember this. The way that you all should go down the road is not relying on your own experience. You should have mentors through an internship, through a mentorship, through a training program. Lean on your mentor's clinical experience. It's their job to hand it down to others. So I was literally doing this presentation for our interns yesterday because that's the week we're on. And they always think that I'm just going to circle things on the form and turn it in like most people who are doing their peak or internship. They forget how nerdy and obsessed I am with them doing the job well. So we actually talk about this stuff before I sign their papers. Okay? So Life University will be happy with me. By individual clinical expertise, we mean proficiency and judgment of the individual clinicians acquire through clinical experience and clinical practice. 15 years, one of the busiest practices ever, especially when it comes to seeing kids. I got me some experience in this gray in the beard here. The other side, though, external clinical evidence, systematic research. That's where this profession needs to level things up. But you're going to see there's a lot more to it than even just these two things. Increased expertise is reflected in many ways, but especially in more effective and efficient diagnosis, and in the more thoughtful identification and compassionate use of individuals' patients' predicaments. Love that word. I can't believe it goes in the paper here. Predicaments, rights, and preferences in making clinical decisions about their care. Let me, Tony, Iowa, 5th grade farmer, interpret that to you. What you learn over time and what is happening massively in the current time we're in is patients' preferences have changed. They want drugs to be last. The brand of our PX Docs platform, our tagline is drug-free healthcare for kids and families. That's it. We literally put drug-free front and center. Because if it's important for a family to give their child a burrito or a chicken sandwich without antibiotics in it right now, don't you think they may pick up on a message of an antibiotic-free, like actual kid, like the kid itself? I feel like, yes, you probably see I'm a little bit funny with this and sarcastic, but the truth is this is what they want. By best available external clinical evidence, they mean clinically relevant research. Don't miss this right here, this sentence. I wish I was better with my slides. I would literally like triple highlight this. Clinically relevant research, often from the basic sciences. I'm going to leave it at that. We're going to move forward to the bottom sentence here. Clinically relevant. People want to get all hot and bothered about RCTs. Do you have any randomized clinical trials? We do not, because that doesn't even come close to fitting in the chiropractic care paradigm, because that would be called treating, and we don't treat our patients, so we can't randomize clinically trial them. So anything that is clinically relevant to a practicing subluxation-based chiropractor is not necessarily going to be all that clinically relevant to a medical doctor or a medically based practitioner. In the same breath, take my sentence and reverse it. Anything that is very extra relevant to a medically based practitioner is probably not that relevant to a subluxation based chiropractic practitioner. You may think that I'm just playing a game of semantics right here and splitting hairs. Not at all. When you're in practice, your congruency is everything. Not for state boards and yada, yada, yada. I don't even know that world. For moms, they need to know that you're in your lane, you understand your lane, you're clear in your lane, and you stay in your lane. And then I love this, basic sciences. We're all sitting around in this profession waiting to see kids until somebody spends the money to put some not even congruent randomized clinical trial together that says, see, kids with ADHD get better when they get adjusted. See, kids with autism or colic, replace the condition with the, and we're waiting for these randomized clinical trials, which aren't even us. They're medicine. And we have 3 other evidence-based platforms we can lean on that we crush the competition on. And we're going to break those down as we go through. Good doctors use both individual clinical expertise and the best available external evidence, and neither alone is enough. So I hope you're not missing this. I know with webinar, I don't have a chat on here, but we can go through it at the end. Don't think that your clinical expertise and experience doesn't matter, or those of your mentors. It does. My point number 1 today is to level up your understanding of how important and how true that actually is. And number 2, external evidence is not randomized clinical trials and meta-analysis only. Basic sciences count for that in this way. Okay? So here's your job. Number one, get to understand that the basic sciences are important. Now, if you learned the basic sciences from a medically philosophized teacher, it's probably hard to apply it in clinical pediatric chiropractic practice. Guess what you're going to learn the basic sciences? Who you're going to learn the basic sciences from today? A practicing pediatric chiropractor. So I'm not trying to teach it to you so you're smarter. I'm trying to teach it to you so you're more clinically applicable to save kids' lives and transform them. Number two, clinical experience. I got me some. I don't have good English, clearly. You can see as we go through this. But I have a lot of clinical experience, so I can share that with you because I've taught it. I've taught our protocols to now well over 1,000 doctors. We just graduated, Christy. It's so cool. We only have been around for just over 2 years with PX. The CERT program with Life University, Dr. Jill, Dr. Scott, Dr. Guy. So blessed they gave us this opportunity. It's been a dream of mine forever to really bring our clinical protocols to the big leagues, and have a real university put their stamp and their seal behind it. And they did, and we have over 500 graduates who have gone through our CERT program as well. So we've taught these protocols. We teach the science and then the clinical protocols to others, and it's working. We're getting results with our patients all over. We're not just symptomatic, subjective results. We track them through the insight. I didn't really have time to work that in today, but we track them through neurological data with HRV, EMG, thermal. So we're actually tracking objective neurological functional changes in addition to the questionnaires and the surveys and the intake. And so we've been working on this for many, many years, and many years down the road, we will publish massive amounts, stacks of paper, and go through that. So the clinical experience is there. And then I love number three, because that is simply meeting Christy where she's at. That's meeting moms who are saying, I understand the role of the hospital, but get me out of here. I understand the role of an antibiotic or a medication, but please give me 18 options and save that one for 19th, right? The world has shifted completely. And especially after the last couple of years, when the medical machine pushed harder than ever, they got pushed back against, and they lost millions of people who were already kind of had like 9 toes off the medical bus. And what happened the last couple of years when they overcooked and overdid everything is they moved that many more people towards us. So here's your job. So let's say you want to step into pediatric chiropractic. The question flow, that's what I'm going to call it here today, that you need to go through in your head scientifically and clinically that I can break down for you is this. Number one, do things that go through early in a child's case history, maternal prenatal distress, so stress and emotions during the pregnancy, plus especially birth intervention, which is really neurological injury, contribute to subluxation. So really what we're looking at, if you isolate step one, do these things that are now, I'll give you the stats. So this is how I stumbled upon the perfect storm. I had an amazing mentor by the name of Dr. Cody who told me, Tony, if you want to help kids and you want to do it in a chiropractic congruent doctor of cause manner, your job is to shut up and take a case history and actually intentfully listen to those moms. The pediatricians and the medical side has no idea. They will blame bad luck and genetics. We know it's not that. We know it's the 3 T's that accumulate and overwhelm. Not just the 3 T's cause subluxation. That's not how this works. But the 3 T's, when they add up and accumulate the destructive survival values enough to overwhelm and overdo the body's ability to adapt, subluxation sets in. Well, what I found taking case histories is I know in our natural health world, we want to get all excited about gluten and toxins, whether ingested or injected or whatever. We want to have this big old battle about that, the middle T out of the 3 T's. So there's traumas, physical, toxins, chemical, thoughts, emotions. What I'm telling you is the 3rd T, emotions, shows up through mom's neurology first, because the umbilical cord is not just delivering nutrients. We don't just need to keep alcohol and cigarettes and red dye number 40 out of there. We now disempower and scare the ever-living heck out of moms more so than ever before. So we have the single most subluxated, sympathetic dominant, parasympathetic exhausted, dysautonomic prenatal population ever. And so that stress that moms are stuck in because nobody supports them, empowers them, and adjusts them, the medical system diagnoses them as pregnant and scares the ever-living out of them, especially if they're age 35 or more. My goodness, I could go on and on. I am going on and on about one thing. That is a huge neurological precursor to neurological problems later on. And then birth trauma. Do we not think that grabbing a big old set of hands, of big pliers or a big plunger, and grabbing hold of a child's brainstem not just skull, not just neck, not just head. Let's not just call it the head. Let's call it what it is. Grabbing hold of their brainstem and their vagus nerve and twisting, torquing, pulling to get them out. We just think it's going to be all right. We just think they're going to grow out of it. That's the favorite. When I say favorite, I'm grunting and talking through my teeth here because I don't mean it. My least favorite phrase is the most common pediatrician phrase still today. Why? Because they don't understand the research and the science. They like to call us unscientific. Their science is as outdated. Oh, I'm on one now here because they are literally, it's like 1974, just walking around with like, stonewashed jeans. Actually, those probably made a comeback. Mullets, those made a comeback. I live in a hockey town. I can't finish this analogy. I'm butchering it. Their science is so outdated. They say to families all the time, don't worry, they'll grow out of it. Oh, colic, they'll grow out of it. Oh, recurrent ear infections, they'll grow out of it. Or did we just change the name from colic to sensory to ADHD to autism spectrum disorder? Is the neurology the same? Because that first thing triggers subluxation. Do we understand what subluxation does? Step 2. The aberrant, there's a bunch of nerd words on there. The aberrant neurophysiology, does that then contribute to the onset and the pathophysiology? I'd like to actually call it the pathoneurophysiology of certain health conditions. Yes, it does. I can show it to you. And number 3. So that's cool. Again, it's kind of like our list before. All right, man, subluxation's happening earlier, nastier, gnarlier than ever. Guess we missed that. We've been so caught up on gluten and glyphosate that we forgot that subluxation is kind of a big deal. So all of us hippie chiropractors are all rage against the machine about toxins. And we're like, subluxation. Yeah, well, it's just your baby is fine. We'll just do a little adjustment. Oh, we got to pull our head out of what. Then we figure out what is the neurology of it. And we're not done. Once you understand it, can you actually do something about it? Your job is to know it, communicate it, and get rid of it. If I could, because I always get further into slides than I intend to when I first build them out. So I have to keep this one a little more brief so I can get into the studies, because I got my favorite studies we're going to review and discuss here before we're done. Certainty, communication, and clinical results. This slide said with a few more words, what we teach our doctors, our interns, our associates, and our pediatric experience members and graduates and certificate holders is these 3 things on repeat. Your first job, certainty, clarity. You need to know it so that no one can move you off your rock. No troll on Instagram, no pediatric. Put me on any panel, anywhere, anytime, ever. Okay? With pediatrician Paula and Paulie, bring it. Because no one can move it, because I've studied it and I've applied it. It's not just the research. Remember, evidence-based care. I'm not just this certain because of the studies. I'm this certain because I took the studies, clinically applied them, saw the results, boom, perfect storm in a positive direction. Now you can't slow me down. And we can't slow this profession down when I can teach these 3 things to enough of you. Know it, communicate it, deliver it. So where do we fall short on number 3, the delivery? What does the research really tell us? Another way I could have presented this slide to you guys is, what are the 3 foundational clinical case management must make moves, long title, that the research shows us kids need today? Number 1, we are completely wussing out on care plans. We are still using a 1974 understanding of subluxation as a bone out of place and maybe pinches a nerve. When you understand that a subluxation is dyskinesia, which leads to disafferentation, which is altered proprioception and mechanoreception, let's say nociception, which pisses off the brain, leads to dysautonomia, which kicks out dyskinesis, dysfunction, developmental dyskinesis, distortion, all the things, dystonia, and tone, motor development is everything for a kid's brain development. I go on and on, teach you a little bit of science. When you understand how early subluxation shows up in a kid's life, how nasty it is, the other word is more severe, then we would stop using care plans that were designed by people who practiced in the 1970s and 80s. Our care planning system in pediatric chiropractic is literally not even an iPhone. I don't even think it's like where you used to have to text by hitting the numbers. It's a landline version of care planning. We are leaving kids subluxated and leaving them sick even when we get an opportunity to take care of them. Our utilization, our dosage, again, and why do people fall back? Why would a chiropractor have a chance to see a kid and recommend hey, why don't we go 1 or 2 times a week and see how it goes? One, they lack certainty. Two, they lack the clinical knowledge that gives that. And three, they were taught by somebody who practiced not today, okay, or puts a lot of other non-chiropractic things in and needs to make room in the care plan. The single biggest thing you can do to increase the miracles you see in your practice, this is why I'm putting it number one, is to increase your care plan frequency. So the initial frequency you see somebody with, and the duration. We have between 2 to 4 kids come to our practice from all over the country. Soon they'll be coming from out of country. It's been tough for the last 2 to 3 years for our neuro-intensive, Perfect Storm intensive program. And we literally will adjust them twice a day, some of them 3 times a day for 2 weeks, okay? No one overutilizes chiropractic for kids more than me, but I don't overutilize it a single neurological ounce because no one understands the neurology and the science of subluxation, neuroplasticity, and neurodevelopment like I do. And the last thing I'm going to do when a mom puts the trust of her child's health in our hands is to wuss out on the care plan. Number 2, biggest mistake we make clinically is kids are over adjusted per visit. They're under adjusted by the care. Check the double not good kind of equation here. If we under recommend care, we tend to over adjust per visit to a very neurologically sensitive situation. Children are so sympathetic dominant. They're so sympathetic excessive, parasympathetic exhausted, that they have a very dysfunctional nervous system. And even so you've heard the phrase too much of a good thing. This is in Stevenson. They used to call it shotgun adjusting. We're more commonly call it flying 7 adjusting. That's one way to inappropriately adjust a kid, is do too much per visit. The other way, and again, I put them on the same line, even though they're quite different. The other one is to miss out on the kids who need bigger adjustments. I will tell you this, I'm in practice. I'm not in charge of an academic recommendation machine. I am in charge of teaching chiropractors who see kids and families how to get better clinical results because kids are online, not politics. And so for me, what I can tell you is that a child who was yanked into this world with a gigantic set of forceps and pliers is not always going to respond to this real light, easy, just touching the ripeness of an avocado sort of adjustment. And I know different organizations will teach that to have some extra CYA into them. How many times do I say the same thing? I don't mean to be redundant. I mean to drive home the points. In practice, kids get what they need. And here's the third thing I have. It's not, even though it's the season of good news, as we do this in the month of December, this may not be your favorite set of news. It'd be nice as a pediatric chiropractor to just adhere to one technique and be like, I slept on the floor of the Gonstead Clinic in Mount Orab. I'm good. I'm a Gonsteader. That's it. I ain't never doing anything else. That was me, by the way. That's why I go right to that one. I grew up Gonstead. That was all I had. This whole tonal, integrator, sustained contact, you take your integrator kite and you fly it out of here, was me early on. And then I got into practice. And some kids need you to bring the hammer, and some kids need you to bring the feather. This isn't me saying this. This is clinical practice saying this. So the number one thing, these are the 3 things, but when we look at number 3, the thing we really hold the line on our PX docs, like in order to get onto our directory, you have to be someone who was trained in the certainty and the clarity. You have to use an actually neurologically, neuroplastic-based care plan system, not a symptom, start 1 or 2 times a week and we'll back off care when symptoms get better, because that's medical care planning, not chiropractic. You need to understand neurotonal adjusting, knowing when to go after it, when to back off, and you have to have a multitude of techniques because different kids need different adjusting approaches. I will tell you the vast majority of our patients, when we start out, their nervous systems, their subluxation patterns, we are actually mixing techniques every single visit. And that is very chiropractic blasphemous. And I'm very aware of that. And I'm very okay with that. Because again, I've never made any clinical decision or teaching decision based upon what other chiropractors think I should, could, oughta, would do. I will always make every decision of what to do in practice and what to teach others to do in practice based upon what we started this webinar on. What patients need, the predicament they are in, the challenge they are in, and the preference and desire they have to get their children out of the storm. If that requires me to level up my care plans, I will do it for them. If that requires me sometimes to back off my adjusting, I will do it for them. If that requires for me sometimes to level up my adjusting, I will do it for them. And if that requires for me, still 15 years in, to be stoked that next year I will be Tony the teacher, the technique teacher. I literally have my own technique seminar and training certification course. I will be going to 2 additional technique seminars that I don't feel I'm a 10 out of 10 yet. They're in my toolkit, network, and some other sort of adjustment some occiput adjusting. I can't wait to get better next year, because my hunch tells me God's going to send me more kids that need that technique. So I'm going to expand my toolkit for them. So I'm a different kind of teacher because we have a different kind of outcome in our eyes. Okay, we had 10 to 15 minutes left. So perfect time to give you some studies and then tell you where you can go and move forward. I wanted to get this training to you, talking a million miles an hour, tons of passion, tons of experience, because I want to get as much to you as I can. But man, I hope I get the chance to continue to train and teach you after this, because this market is here for us to make impact in right now. And the science backs us up. So I made 3 slides with some pictures of my favorite studies here. Know this, our follow-up that Christy and the team are going to do. I have what I've been working on this for years. I just updated it again, getting ready for today's webinar. We have what we call the Perfect Storm Science Armor document. So it's our shield. It's our understanding. It's all the citations. So every study, I'm going to show you 5. There's way more than 5 that are in that document, that PDF that the team will send to you after this. And you'll have all the links. You can get them online. You can go through them all there. You even get a little, what's the word I'm looking for here? A good bit of commentary and interpretation written into that document. So kind of this webinar of me a little bit written out. So I'm going to discuss these. You don't have to go Google these or screenshot this. It'll come into that PDF for you, and you can have it from us. This, again, and that is not something we typically give out. That is not something we're going to give per se, in a regular Facebook post or something like that. But seriously, Chiro Health family, I would not be in this pediatric practice if I hadn't gotten out of the one that was not perfect for me. And so I always kind of like to do a good bit of extra giving to the ChiroHealthUSA crew. All right. So the incidence or correlation studies, these are 2 of my favorite. The one on the left is an osteopathic journal, the Journal of American Osteopathic Association, done in 2015. And you can read the whole thing when you get those citations. But what it says is this: they literally did a physical palpatory. So remember, DOs, quite a bit different, but some similarities to us. They did a physical exam for somatic dysfunction in healthy newborns. These aren't even colicky, fussy, challenged newborns. These are symptomatic for, again, what's the definition of healthy? Well, in the medical system, not a very good one. But you're going to know where I'm going with this. So they're doing all right. Somatic dysfunction, that's their word for subluxation. All right? Lack of proper alignment, most importantly, lack of proper movement. If we break down subluxation, and I like to keep it just super simple, I know it's misalignment, fixation. Those are the first 2 parts that lead to aberrant neurology and aberrant physiology. That's the 3rd biggest part. They don't really get into the neurology. They're osteopaths. 99 newborns had at least 1 strain pattern, 1 somatic dysfunction. Condylar, occiput, 95%. You can go on down the road here. Sacrum, 80%. So they found presence of subluxation in 99% of newborns. Over here, long title. I love it. Incidence of, I went backwards, didn't I? I got you. Hold on. Incidence of pre, peri, and postnatal birth and developmental problems of children with sensory processing disorder and children with autism. Once you cover sensory and autism, by the way, you pretty much got ADHD and anxiety into the paper as well. And that paper found that the more influences of stress during the pregnancy and intervention, birth, forceps, vacuum, those sort of things, breech position, the higher rates of these things. So what I'm showing you this for is when we go back to our evidence-based care model and we say, is there stats? Is there incidence? Is there correlation to these triggers in the perfect storm science sequence? Maternal distress and birth trauma. Does it correlate to, number 1, subluxation, and number 2, conditions? I'm more obsessed with connecting it to subluxation, not as obsessed with connecting it to conditions, because I'm not working in a treatment or a cure-based model. But hear me, homies, I'm not a parent. I'm a practicing chiropractor. Parents give no craps about the word subluxation, and they give all the craps about the word autism, sensory, and please help me get rid of it. So what we need to do in practice as a chiropractor is keep our practitioner philosophically congruent hat on and our parent empathetic, emotionally understanding what are their desires, what do they need to hear and get from us. And it's a dance. It's a sweet spot. Can you get way too caught up on talking about conditions and way too caught up on pathologizing subluxation in the nervous system? Yes, you can. That's why in green, loving chiropractic seminars, they don't even ask patients how they're doing. Tell you what, you want to grow a pediatric and a family practice, you need to have the hard conversations. You need to know how to talk about anxiety. You need to know how to talk about colic and autism, because no mom's going to roll up to you at random and go, hey, Jack, I've been thinking about these universal intelligence, innate intelligence, and these subluxation thingies. What do you have for me here? No one knows our freaking language. So if we're going to get too proud and try and talk about and only research in our language, we will continue to stay limited in our impact. If we can marry these worlds up through the language of science and research, we will change the freaking world. That's the drum I've been trying to beat this whole time. And I hope as we get towards the end of the hour, it's starting to really, really come together how insanely freaking valuable, one, knowing this science and research is, two, communicating it to the public and to other providers and to the world is, and three, backing it up, clinically applying it in your protocols so that you actually get results. Because knowing it and talking about it ain't it. Knowing it, talking about it, and delivering it is it. That's your job. Not one, not two, all three. Do not step into this space. If I'm lucky enough to be reaching out here through this platform to some pain-based chiropractors, to some people who have best been like, harumph, pain-based, spinal care only, musculoskeletal, white coat, we're doing it. And you're so against this, I hope we opened up at least a bridge for you to see, hey, there actually is a lot here within the evidence-based care model. There is a lot within practice experience, with science, with meta-analysis and external evidence. These are external evidence papers we're looking at combined with internal practice experience. But what I will say to you is anybody who's feeling inclined, anybody who's feeling it right now, getting the gusto, I had this is how I got here, where you feel pulled into pediatrics. I ask for the sake of those Olivers, that's my miracle man, and all the kids out there, I ask that when you move forward, you commit to all three. You commit to not just studying it, you commit to not just saying it, but you commit to slaying it and adjusting and taking care of them as well. So I'll put a bow on it with these last couple of papers. I just wanted to make sure that I don't run out of time at the end to say, when you move forward into a pediatric practice, it ain't near as easy as a pain-based practice or a wellness-based practice. You can kind of script those. You can kind of go through those motions after a certain time with this. Every mom, every time will require you to be at the top of your game, all three phases, all the time. And I didn't want to BS any of you because it's my job that I've been blessed to have here today to help you down that road. That's the road. So favorite science and neurology investigations is this paper right here. A friend of mine, Dr. Bruce Stevens in California, always got to give credit to mentors and people who helped me find these things, sent this to me years ago. It's a paper out of Princeton. It's the Neuro Research or Neuroscience Lab out of Princeton is where Dr. Wang and crew work. And what they found, the reason they stumbled upon this paper and they wrote this whole thing out is they were doing meta-analysis, kind of post-analysis of children with autism. And they found that kids with autism had a 40-fold increased incidence of autism if they had a documented cerebellar injury. Now, what they're looking at is pretty heavy stuff, pretty traumatic sort of stuff. And so they coined this term developmental diaschisis. And they started to link it together and they go, we've been looking for autism in the prefrontal cortex, in the parietal cortex. We're still doing this. Our profession awesomely is getting obsessed with the prefrontal cortex and right and left brain hemisphericity. And we all of a sudden, the further we get into the brain with our study, I'm on another rant. I don't have time, Christy, I'm going to do it. The further we get into the brain with our study, the further away we get from chiropractic. It's like we go up and then we're like, forgot about the spine and the nervous system. Yes. Subluxation creates hemisphericity. Obvi. You can study the research for just a little bit and understand that. Yes, subluxation is going to alter the function of the prefrontal cortex. So in converse, yes, an adjustment and neurological input done appropriately, proprioceptively in the primary subluxation patterns with the right tool at the right time with the right frequency is going to improve hemisphericity, is going to improve the cerebellum, then the amygdala, cerebellum, thalamus, amygdala, hippocampus, prefrontal cortex. What these guys are looking at is they looked at autism like all medical researchers did, as a brain-based, front and side-based brain of the problem. And guess what medical research has never done? Found autism in the brain, found ADHD in the brain, found anxiety in the brain. Medical neurologists still think the nervous system stops at the foramen magnum. And it's like, there's just a little thing hanging from the bottom of it. It's like the brain. It's not really, the door doesn't really close. Kind of an open door, like with the spinal cord and a lot of stuff that is there. So the central nervous system kind of keeps going here, Rick. And it's just, anyways. So diastasis is the word they coined. It means shock throughout. Normally, I show this study with a video of a C-section. And when you see a child be born via C-section, forceps, vacuum induction, or birth intervention, it is a shock throughout their central and autonomic nervous system. Diastasis is a sudden loss or change of function in a portion of the brain connected to a distant but damaged brain area. The site of the originally damaged area and the diastasis are connected to each other by neurons. You could have read that yourself. You got it on the slide. Before we move on, we put a bow on this thing. Let me take one word and change it and read the rest the same. Subluxation is a sudden loss or change of function in a portion of the brain and central nervous system connected to a distant but damaged brain and central nervous system area. The site of the originally damaged area and the subluxation are connected to each other by neurons. What's different? It's a good question. Not much. So medical research, basic science research around these neurological, neurodevelopmental challenges they use the words distortion, disruption of communication. Have you ever described subluxation as disrupted communication between the brain and the body and the brain and the nervous system and the environment? Yeah, well, that's a great way to describe subluxation because that's exactly what it is. And there's now neurological proof to say that's linked up to all these other things. And then the vagus nerve. I would be remiss to not close this sucker down without bringing out our homie, our bestie, take it with us everywhere we go. Make sure it's operating uninhibited. Because if you got a vagus nerve that kicks ass, you got a life that kicks ass. And if you don't, you don't. So vagus nerve, parasympathetic functions in children with sensory processing. The paper on the left took 3 kids with sensory issues. None, mild, severe. They did HRV studies, which we use. If you practice in today without technology like HRV, like the Insight, get a hold of Fletcher, get a hold of CLA, don't have a neurologically based practice relying on palpation, posture, and x-rays alone, because those are physical exams with a little bit of neurological data to them. The Insight scan is a must-have tool in a neurologically based practice, especially if you're going to see kids. And so they did HRV. Kids with no sensory issues had higher vagal nerve parasympathetic tone as compared to those with lower. They then challenged these kids with the 7 different senses. And when you would need your vagus nerve to respond, to modulate and mitigate the stress in your environment, children with sensory processing disorder severe had the lowest resting vagal nerve tone and the lowest responsiveness of their vagus nerve when challenged. What would lower vagal nerve tone at rest and limit vagal nerve tone and activation when needed? Subluxation is exactly what does that. And the final paper is this one over here, the vagal nerve innervation of the gut and the immune. I'll go to the highlighted here. Central nervous system interacts dynamically with the immune system to modulate inflammation. It's almost like you feel like, who wrote this? Dr. B.J. Palmer? This is a chiropractor paper? No, it's not. But they're speaking our language. Vagal nerve electrical stimulation potently reduces intestinal inflammation, restoring intestinal homeostasis, whereas vagotomy has the reverse effect. I'm sorry if you love rats, but here's what they did to these rats in this study. They took rats, same genetics, same sleep, same nutrition, same exercise, same environment. They took some of them and they karate chopped their vagus nerve. Vagotomy means not just subluxated, annihilated. Then they took another group of rats and they put a little electrode on them and they gave them vagal nerve stimulation. And the gut health of the rats with the same diet, the inflammation potently reduced. So if you're spending your days spending more time talking to your community about gut health, microbiome, and probiotics than parasympathetics, vagal nerve tone, and how much your pisiforms light those suckers up, you're doing your community a disservice. Because I ain't saying that we can all walk around, get adjusted, smoke Marlboros, eat Cheez-Its, and live a healthy life. We definitely need to have a healthy diet and environment. But the single most important healthy environment we need to keep track of is our central nervous system, our autonomic nervous system, and our vagus nerve. So what action would you take? Oh, look at that, 2:14. I am on it. That is, what? Am I literally right on the hour? Oh, Christy, you're going to give me a big hug next time I see you anyways. But staying on time, I might get just an even bigger hug here, all right? So what action should you take from here? Study your face off. It's your responsibility. It's one thing. I'm not even trying to minimize it, I'm trying to contrast it. If a dude or a dudette with back pain comes to you, I hope you are the best in the world for that patient. I'm not. We actually refer out most of our musculo. No, they're not. Nothing is musculoskeletal. How do you take the neuro? You can't take the nervous system out of anything, right? Not even back pain. So if a neuromusculoskeletal patient comes to us and it's of any sort of challenge, we actually have a great relationship with 2 or 3 other local chiropractors whose calling is annihilating back pain without drugs. They send us pediatric tough patients. We send them tough back pain patients. If it's this, when you're taking care of kids, your responsibility is to be the best of the best of the best of the best, okay? Don't take care of kids if you're not willing to cross these 3 lines. The way you do that is you study and you learn it. It's available to you. I'll cut right to it. It's available to you through me. If you loved this training today, we literally have not only our entire training membership, but it is required that the first 10 to 15 hours everybody goes through, whether they're coming to a seminar or whether they're taking our online training, is you have to go through the perfect storm 10D model. So the dyskinesia, disafferentation, dysautonomia, dyskinesis, developmental diaskesis, and there's a bunch more to it model. And we go through all the research, we go through all the communication, and we go through all the clinical application. You got to study it. There's the second part. We go right into adjusting. We go right into our clinical protocols. We teach this stuff both online and in person. And then guess what else we do? Not a damn thing else. Because here's the thing I'll tell you. When you do this only, so there's a little look under the hood with our training and just what people will say about it. All I know is all I need to know is limit myself to 1 video indulgence a day so I can grasp it all. Wish I had the education of my own kids. Every time I listen Recommitted, this is what it looks like inside our training curriculum and inside our online training. You can get everything you need from me in the pediatric experience through an app on your phone. You can watch it while you're working out. You can watch it over your lunch break. We can train you on the certainty. We can train you on the communication, and we can train you on the clinical delivery. And I love the shot. And then Christy, I'll give it back to you, my friend. We'll leave this up here for a second because grab your phone, QR code that thing. Your first month of training with me is for free. And I'm telling you, it's about 10 to 15 hours of the science videos. So if you got on this webinar because you're just that excited about science and research and subluxation and neurology and what we went through today, you're like, I will take all of that. You can get the first 30 days, you can easily go through all the science videos. And if you don't need the rest of the stuff, well, there's no contracts. There's no nothing with the Pediatric Experience membership. Nobody ever leaves because it's just so dang valuable on the inside. But we'd love to see you on the inside, training on that science and research, training on the communication, training on the clinical application. You can see the bullet points. There is a whole lot more that comes with your Pediatric Experience membership. The way we train today, I would love to keep you focused on what matters most, which is the science, the communication of it, and the clinical delivery of it. And first month it's only literally $295 a month for a practicing doc and $145 for a startup and a student. So it's a no-brainer anyways. But first month for CHUSA crew on me, Miss Christy. Hope that was enough research to get people fired up, but not too much research to get them overwhelmed and not see the clinical application. Because I'll just close with my title slide. I did everything. This is clinically applicable. You apply it to your care plans, you apply it to your adjusting, and you apply it to your technique, and you add to your technique is probably a better way to say it. You move those 3 levers going into 2023, your percentage of pediatrics will literally triple within 12 months because moms will find you when they know you know what you're doing.
You just did amazing. I just love you. Y'all should see this man in person. You can feel his energy even if you're sitting in the back row. It's a little toned down in the webinar, but as you can see, he's more energetic than most webinar presenters. So, Tony, I did realize that your team had polls set up in here, and I didn't launch them because I didn't know when or where, but you'd already started when I saw them.
Oh, I didn't even. That makes two of us that didn't. Did I actually come up with a poll ahead of time? That's actually, that's saying something there, buddy. I'm growing up.
Well, no, it's good. Your team spoke to my team, and then now you and I are both I don't know what's going on.
This is life for our teams with you and I, right? That's all good. They love us, Christy. We know this. We know.
Well, if y'all are watching, forgive us.
Yeah.
we appreciate all that work you did. We just kind of did something different. So anyway, I just want to thank you so much for being here today. And of course, we'll have you back again next year to hear what's going on. And I don't see I did. One question that did come up was, would they be able to get a copy of some of the studies?
Yeah, so you guys are going to send out the replay and everything, right, to everybody who registered? Yeah, so attached to that, so our team sent to the ChiroHealth team, it's called the Perfect Storm Research Armor document, kind of a fun little name. The armor is to increase your certainty. And so all of that there, Tina, that'll all be in there. Every one I did today and a whole bunch more. And then, Donald, I see that question about how to plug it into patient education. We do. The tips I would share on it is, we don't, with patients, we don't really worry about sharing the citations and that sort of stuff. What we do is we make videos and we write articles that are interpreting this stuff in their language. That's probably something that God has really, really blessed me with, is not just the adjusting style of things, but the communication style of things. And being able to take this, PhD stuff, diascasis and disaffrontation, and teach it in analogies and metaphors. If you want to take a look at PX Docs. So that's all together, PX Docs on Instagram. That's our parent-facing education platform. You can kind of see it in action there and start to model it from that. And then through our PX members, we give a ton of our education. That's part of it too. It's not just the clinical training. All of our marketing and our educational resources are given to, or through, I guess is probably a better word, Christy, to our PX members. Because the last thing we want to do is keep it to ourselves. Once we figured out this stuff works, it's let's go, and get it out there. So, but the reason it only goes, we don't have a marketing wing separate from our clinical training wing, Donald, because I'm not going to give somebody the marketing materials for pediatric chiropractic until I've trained them to deliver the goods. That's just what's the word I'm looking here for, Christy? That's just kind of a ethics thing. I don't know if that's the right word. Sleep at night thing for me.
I would totally agree. Well, and I did go ahead and put the link to the Pediatric Experience on Facebook, and I did write PX Docs for the Instagram so that y'all can follow Dr. Tony and his crew on social media. He is not kidding. They are the loudest of loud, entertaining. You can read the testimonials. There are some national stories out there where Dr. Tony and his team have been involved, other chiropractors that I work with, the women DCs, where trauma has happened to a child even as early, at 2 years of age. And you can watch the whole story unfold, not just on their Instagram and Facebook, but when you follow the parents posting the impact it made in their child's process of healing once chiropractic entered into it. It's no joke. You see Dr. Tony will hop on a plane and he'll fly clear across the country to be with a family to help them and meet with their medical team, do what he has to do, meet with a chiropractor in the area where they live in. because obviously he can't just travel all over the country treating babies. But it's just pretty impactful. And like I said, it was very impactful to our family. So
Okay.
I can only imagine how other families felt. And I would never have known about it had somebody not said, have you ever seen Dr. Tony Ebel's Facebook page?
Yeah.
So there's so much good work out there that you can all be doing for the children in your community and their parents, because their parents need support as well.
Yeah. And I think, everybody, you'll be much more apt and inclined and excited to post about it and be loud about it when you get louder on the inside. I know that's cliche and that's kind of a Chiro ADIO thing, but no, we're not going to be. I wasn't loud about pediatric chiropractic coming out of school or anything. I had to really study it and train and honestly, even then see it for myself, kind of get in the community, talk to a few parents and get it that. It seems like a big, fast moving thing is now, because it was, but I moved more steadily early on. So if somebody's kind of newer into this, by all means, take those steps we were talking about all day. Get the science training first, get all that going. And then on the contrary, if you're like me and Nancy Cooper and the rest of us, who've been at it and we just know, well, then by all means, never shut up. I did the BJ Palmer quote, I will, you never know how far reaching what you think, say, or do may affect the lives of millions tomorrow. I think we can upgrade that with a little social media spin. You never know what you post about how far it will reach millions. It could literally go viral. Pediatric chiropractic is going viral. Our website is taking over with SEO. We literally have an entire strategy there. Our social media, we have the best social media. We've literally hired teams of designers, copywriters, social media influencers. I'm going to be on some huge summits with Dr. Axe and others next year talking about pediatric chiropractic. So we need an army, y'all, because Christy and her crew are coming for us with their babies, and we got to get our stuff together.
I love it. And, here's the thing, too. I was going to say, I meet so many chiropractors who haven't found that their heart thing yet. You do this job, every single one of y'all, because you fell in love with chiropractic. But there are people who don't want to do low back pain, or people who only want to work with athletes, people like my son. And I don't know where this comes from. I mean, he's in high school, but all he talks about is helping veterans and active duty military. No idea where that came from. That's his heart. It started with babies, and then he moved. He moved to the military.
Beautiful.
But you found yours in pediatrics. So what's your sweet spot? What is your passion? And if it is the babies, then you should be following this crew, because they're making miracles happen every day.
Yes, ma'am. Yes, ma'am.
Well, y'all have an amazing, epic day. I posted the links for the upcoming webinars in January. Hope everybody has an amazing December, has a beautiful wrap up to your year, because 2023 is going to be the best year yet for this profession.
Love it. Thank you, buddy. Thank you, everyone.
Bye.
Bye, bud.